Okay, so first things first, in terms of understanding how to move well, is understanding how to find a neutral spine. This comes before literally anything that we do in the gym, and is a primary prerequisite for your ability to be able to move safely and move well under load. Now, a neutral spine can be simply defined as having congruency between our diaphragm and our hip line. If I have two imaginary lines pointing out of roughly where my diaphragm is and roughly where my hip line is, they should be parallel. They shouldn't be opening and they shouldn't be closing respectively on either side. Now, deviating from a neutral spine can have consequences. I can deviate from a neutral spine in two ways. I can go into an anterior pelvic tilt or a posterior pelvic tilt. Everything that we do in the weight room should be done with a neutral spine. To find a neutral spine, all you have to do is place your hands on your hips. Imagine you're holding a bucket of water in your hands. From there, you can rotate that bucket of water forwards or that bucket of water backwards. Anterior pelvic tilt, posterior pelvic tilt. Now, as a little drill, all you have to do is rotate forwards, backwards, as far as you feel comfortable going, and then find the middle point between those 2 points. Roughly speaking, that is a neutral spine, and that is the position that we want to be able to get into before we do any type of other movements, such as a hinge, such as a lunge, or even a bench press. If you are not in that position, you're going to place a lot of excess stress either through compression or lengthening at the lower back. Okay? The final piece to add to that neutral spine position is a strong diaphragmatic breath. A diaphragmatic breath is going to allow us to reflexively stabilize through the core, as well as pull the rib cage down to get that preferential activation. To do that, find a neutral spine, and then inhale through your nose, and exhale strongly through your mouth for as long as you can. Notice that when I inhale, my rib cage expands, pulling air into my lungs, and as I exhale, my rib cage pulls down. I feel my abdominals when I exhale. Super important. What you just did there, or what I just did, was I braced in a neutral position. Again, super important for anything that we do whenever we are moving or whenever we are in the weight room.